Welcome to Long's Place. As soon as the mic gets going, thank you all for coming today. I don't know why nobody we're going to have a great time today. Really blessed. Looking at some of the ways the first thing I want to do is I want to thank Lance on the back of the there. Also, busy will happen. Also, I wanted to recognize we have some of our elected officials' offices here. I didn't see any elected officials. Hello? Yay, all right. Awesome. I can stop yelling. We have some representatives from, I believe, Supervisor Chafee's office here, right? There you go, Jesus. We also have representative from Assemblywoman Pitchy Cotty Norris here as well, over here. And then we had a few others, but they at last minute they weren't able to make it from Supervisor Sarmiento's office. But anybody else that I miss? Anybody? And Josh Newman's office was here. Are you here right now? Oh, there you go. Josh Newman's office is here as well. Who else? Did I miss anybody? No. All right, good. Awesome. Well, aside from the elected officials, we have also funders in the room. We have service providers in the room. And as I look through the list of the organizations you represent, I think beyond that about who you're serving. And you're serving the most, those that are in most need, the most vulnerable. And thank you for all being here in the conference. Thank you for what you do each and every day as well in serving those that need your support. I think this conversation here will help launch us into how do we work together collectively through our government, through philanthropy, through our non-service profit service providers. How do we lock arms and really come together and address some of the barriers that your clients are facing? So, okay, so that's all my thank yous. I also want to actually, never mind, I want to thank Mike and Claudia and Mark as well, and I'm going to bring them up in a few minutes just to share with you about the OC Hunger Alliance, but they are the current steering committee for the Alliance, so I want to thank them for allowing myself, Jack Twan, I forgot to introduce myself, as a consultant, and I work with Charitable Ventures, who's working on this needs assessment, and then also convening everybody here. So, thanks Ann Olin with Charitable Ventures over there, as well, for doing this work. All right, so here's the agenda for today. And right now, I would like to actually bring up the OC Hunger Alliance Steering Committee. And Mark, Claudia, Mike, come on up.
Thank you, Jack. Appreciate it. We want to take an opportunity, first of all, to thank you all for being here. This has been a goal and a dream of ours for a very long time. To be real brief, we looked at this several years ago. Well, wow, we tend to work in silos. We don't really connect, but there's public, private, nonprofit players out there that we tend to ignore. And so the Hunger Alliance was born, and Mark will give you a background of how it was started, but the goal is just to bring everyone together where food is the centerpiece or food plays a part. And the reality is, as someone so wisely explained to me once, you got to eat every day. So food is the centerpiece. Nutrition is the cornerstone. So it touches on so many other programs, so many other social determinants of health. So Mark, I'd like you to give a little background.
Thank you, Mike. Again, Mark Lowry, Orange County Food Bank at the Community Action Partnership of Orange County. And I know a number of you have heard this story before, but it was about 4.5 years ago when I got a call from the new CEO at the Second Harvest Food Bank of Orange County, Harold Herman, Claudia's predecessor. And he wanted to tell me a story about how he had just started at the food bank, had put a photo or picture of Orange County up on his wall, asked his staff to plot all the food pantries in Orange County so we could look at hunger in Orange County from a strategic perspective. You know, where were the needs and where were the resources, where was their gap and was there overlap? And when he met with staff, he said, so which of the food pantries are ours and which are the food pantries that partner with the Orange County Food Bank? And his staff said, well, they're all ours. He said, well, where's the Orange County Food Bank's pantries? And they said, we don't know. So he invited me to breakfast and said, how are we supposed to look at hunger in Orange County and moving the needle on reducing that if we're only looking at one half of the picture? So we said, to our credit, we'd been polite and respectful and courteous with one another, working together in a community. But to Harold's point, we really hadn't sat down at a table together and planned a strategy together to reduce hunger in Orange County. So we started that, a meeting on a weekly basis. One of the first things we quickly realized is that, you know, I hate using the word industry, but every industry changes and evolves. And one of the things that we saw was there was a new state law that had passed that was going to require that all food establishments throw away way less food. So there were 15,000 places in Orange County where there's prepared and perishable foods, and our community was now going to be challenged to try to capture more of that and throw away less of it. And as food banks, we really didn't have a great expertise on trying to figure out how to get to 15,000 different locations each day. But in Orange County, we had a resource in Mike Leorakis and Abound Food Care, and that was their niche, that was their expertise. So we invited Mike to the table. And for the last 4.5 years or so, at a minimum, we've been meeting every Monday at noon, although there's often tasks that involve us during the course of the week. It was 4 years ago yesterday that Governor Newsom imposed the stay-at-home order in California, and our world changed. So in those first few years of the collaboration with the Orange County Hunger Alliance, the United States Department of Agriculture started a Farmers to Families program. It doesn't exist today, but it existed during COVID. Sent hundreds of thousands of food boxes, nutritionally balanced food boxes to Orange County. But we didn't get an allocation. It was incumbent upon us to go to some of the vendors that got these contracts with USDA and convince them to give us food. But as the two food banks, we went and solicited that food together. And when we were successful in getting that food, we sat down at a table together. And we decided where we would ship that food so that some communities wouldn't be overwhelmed and other communities underserved. We went to the Orange County Department of Social Services. One of the great ironies in our community is when we often have too little food to meet the needs of our communities, our federal nutrition programs are sometimes underutilized. And CalFresh is America's largest anti-hunger program, but there were hundreds of thousands of Orange County residents eligible for but not receiving CalFresh. So we met with our partners at the Orange County Department of Social Services and said, what if we picked a goal and said, we want to grow participation by 15,000 people in the next 12 months. Let's partner to figure out how we can help you accomplish that. And our partners at the Orange County Department of Social Services met and exceeded that goal. So over the next several years, even when we were struggling with food issues, we went together and asked the Orange County Board of Supervisors to provide additional monies for us for the purchase of food. We weren't competing for food, but making a request together. And the County Board of Supervisors responded generously to that. And in the course of 4 requests, we received $14 million to purchase additional food that we were able to bring into your communities. So those are just the examples of some of the things that we did as a group over the last 3 years or so. Claudia's going to bring you up to date on some of the things that we've been working on most recently.
Thanks, Mark. Continuing in that vein as to why we're here, what we're doing, what we've accomplished, I want to take a pause and point your attention to our Orange County Hunger Alliance mission and vision, right? Our mission is to optimize the emergency food system and leverage food assistance to address root causes of poverty. And our vision is a healthy Orange County community with equitable access to nutritious food. You might be thinking to yourself, whoa, that's really lofty. It is really lofty. It's also very achievable. But it's achievable if we start down a path, and this is going to sound very cliche, where we can walk and chew gum at the same time, right? When I stand here with my brothers in arms, Mark and I, our mission is very different. The organization of food banks is very different maybe from what you see here, and certainly from what Mike does, right? We are feeding people right now. Many of you are feeding people right now. And that's super important right now. And we can't stop doing it. And I cannot stress the importance of making sure that the charitable food system remains strong in this moment. However, after food banks being in existence for 40 years, clearly what we're doing day to day, while valuable and critical to everybody, is not enough to get ahead of the problem. So we have to walk and chew gum at the same time, all of us together. And hence what the Orange County Hunger Alliance is trying to do. Some of the things that we've successfully started, and I'll name 4 off the bat. The first thing is advocacy. The Orange County Food Bank and Second Harvest Food Bank for many years have had advocates. 2 of them are sitting right here at the front table, or one of them. And we go to legislators and we ask them we weigh in on certain policy that we think will be favorable toward our mission and those that we serve. Well, in the past, Second Harvest would have gone to a state senator and asked for something. Orange County Food Bank would have gone, and we've had 2 meetings that accomplished the same thing. The power in going together. When Mark and I first started going together, there was a recognition that, you have the same mission. We have the same mission. We have to work together. And today, our advocates do not advocate on behalf of Second Harvest Food Bank or Orange County Food Bank. They advocate on behalf of the Orange County Hunger Alliance and the network that we represent. Secondly, we are addressing logistics. It is probably evident to everybody, if you thought about it, and if you haven't, that's okay, that Second Harvest will send a truck down the freeway south to make crucial deliveries, maybe half full. Orange County Food Bank may send a truck in a different direction to deliver critical food, half full. And many of you have vehicles that may sit certain days of the week. So we have space in our logistical infrastructure to better utilize the assets that we have together. And that is one of the projects that we are starting to address. In that same vein, procurement, not only of food, but of supplies. And let me be crude here. We all buy toilet paper, right? We do, for our pantries, for our food banks, right? Imagine if we all bought it together, how much money we could save. But we don't. We're not capitalizing on economy of scale. And that is one thing that the Enhanced Procurement Program is looking at, from food to supplies to fuel. What can we do better together as a united network? And then finally, we are looking at service itself. I often say that food will not end poverty, but without food, no one is lifting themselves out of poverty. Food is the front door. Food is the hook. Food is what people need today. But what they need tomorrow is many of the services that your organizations provide, whether that's workforce development, mental health supports, housing assistance, utility assistance. All that can be accessed through an enhanced pantry system. So we are looking at ways to create those hub and spokes, those networks within the system where we can better address poverty and lifting our neighbors out of poverty. I often say that hunger is hidden. Your neighbors, your kids, friends, it's the problem that we may not see, but everybody in this room, I know, sees it. So I am thankful for being here. I do want to call out one person that is here in the room that's very special to me, and that's my board member and former professional of the Orange County Healthcare Agency, Mr. John Rawls. John, say hello. And now I'll turn it over to Mike.
John was my former health inspector at my restaurant, so I still get nervous every time I see him. I can't get past that. So just to be real clear, our goal here was to really, kind of maximize the impact we could have with food. But and all of you are a part of that. But what we really were lacking was the data. In other words, we're really not able to track, what are we doing with the food that we have? What's the impact on people? So it's a push to really get data. And then also, who are we serving? And are we doing the best job possible, aggregated, in serving every demographic? So I want to point out we have had supporters here. Philanthropic support. The Samuele Foundation. Is there anybody here from Samuele Foundation today? Oh, there you are. There you are. Samuele Foundation, to me, again, as a nonprofit outsider for most of my career, I was shocked at how many times as a funder, we didn't really know where the money went, or we weren't really told what those stories were. We didn't identify what the outcomes were. And we were encouraged to just keep jumping over a really low bar over and over. So we were limited to how many pounds of food distributed, how many families served, or in our case, how many pounds of food recovered. It doesn't tell the whole story. So we were able to get philanthropists who will encourage us to change a system, to encourage or to strengthen a system. And that's really the key to this. So our shout out to the Samuele Foundation. And then also one of the reasons we're here is because of that initial funding that allowed us to focus on some of those 4 areas and get the ball rolling. The county, through the Office of Health Equity, provided a grant for this collective, this Hunger Alliance, to convene everyone with the goal of identifying what is the food system like for those that rely on it, and what is the food system like for those organizations that serve those people. In other words, how difficult is it to get food? Are we getting them the right kind of food? What are the challenges they face? Are we really in tune with the system as it operates? Because we can't make that change until we walk through it. So, and then we were very fortunate to bring aboard Charitable Ventures. Anne and her team, led by Jack, have conducted the surveys, have done a phenomenal job of being able to connect with the community to get everybody's input. And we were very cautious. We never wanted to be perceived, nor did we ever really want to put our foot on the scale. We started with there's what we know and there's what we think we know. And until we know it, we don't know it. So let's reach out to the community. Let's reach out to all of you. So without any further ado, I'm going to bring Jack back up here to kind of walk through those results of our work so far.
Thanks, Mike. Oh, cool. It works now. Okay, so Mike went over this very briefly, but I'll show you the slides. So you mentioned the Equity and OC grant. And it's really about bringing everybody together, really looking at equitable access to food and nutrition, right? So this is, and Claudia mentioned this as well. So and then this is the work plan for the IOC. So part of the work that happened, as Mike mentioned, is this landscape analysis, and really looking at, okay, where are we at from all the, we looked at a lot of the research, where are we at? And then also, sir, you helped us with only not responding to our survey as a provider and seeing what is happening on the ground, but also survey the clients as well and seeing their perspective. And the team will share with you what kind of numbers came back in terms of participation, but really the volume of response we got was because of your assistance. So really appreciate you participating and helping out. And by the way, it wasn't just pantries. It was also people who are, organizations that are working with those that are coming for other reasons, but they learned that, hey, there's food insecurity situation. Really kind of hearing from all perspectives. So without further ado, I'm going to bring up our data team and Lamore and Simran, but Lamore is going to start. We're going to frame the issue, and then Simran is going to come in and share with you the survey data.
One cup of coffee of the day. Good morning, everyone. So I'm Lamore Finskin. I'm a consultant with Charitable Ventures on this project. And what I'm going to go through is to kind of give a background of the data that we have in order to then set the context for, there I am, for Simran to talk about some of the preliminary survey findings that we've had. So this information is based on a pretty recent needs assessment done by UCI. And what they found was that about 8% of the residents in Orange County were considered food insecure. And this is actually slightly lower than the California average of about 10.2%. We also found that about 14% in Orange County are living below 100% poverty. And 100% poverty is basically, in 2024, was $31,200 for a family of four. And so about a third of the population are living below 200% poverty, so making about $62,000 or less a year. They also found that more than half of the renters are paying more than 30% of their income on rent or housing, which of course leaves a lot less money for other things like childcare, transportation, food, and other things. And that while a good chunk of the adults say, yeah, we are able to get those fresh fruits and vegetables, a much smaller percentage, 56%, said, you know what, we can get them, but it's actually pretty unaffordable. Looking into the populations a little bit more, it's not surprising that undocumented immigrants were the hardest hit with food insecurity, mostly because of lack of access to services and resources and fear of deportation. Black and Hispanic households also have a higher than average rate of food insecurity, and disabled adults are at a higher risk because, again, they have usually lower, like a limited employment opportunities and higher healthcare expenses. So those are kind of like big picture Orange County. What I wanted to show now is to go a little bit, dig deeper into areas within Orange County. And so before I show you this, well, before I explain this map, I will say overall in Orange County, the percentage of households receiving SNAP benefits has been increasing slightly in the past 5 years. And looking at it by cities versus this is by census tract, by cities, the city of Midway City actually has the highest proportion of families who are receiving SNAP benefits at about 29%. And then the next city after that is Stanton, which is about 15% of the population of the households receiving SNAP or food stamps. So looking at this map, which is showing the same data, but looking at it at the census tract level, so it's much smaller levels of geography where you can kind of see where there's geographic differences. We see most of the highest percentage of households receiving those benefits living in central Orange County. Okay. This map is showing food insecurity, which is the index, which is basically a measure of economic and household hardship that's correlated with poor food access. See that 10 times fast. And again, we see that most of the areas that have a high insecurity index, which is like those darker areas, are in central Orange County. And then looking at food access, what this map shows, first of all, this is from 2019. So this is federal data that's presented every 5 years. So hopefully in the next year or so, we'll get updated information. But what this is showing is those census tracts that are considered low income and have a significant proportion of their residents who live more than 1/2 mile away from a grocery store. So it's showing kind of like where are there areas where it's both low income and it's a little bit maybe harder to get to food options. And about those dark blue spots represent about 13% of the census tracts in Orange County. And then finally, this is the same map, but now we've overlaid it with pantry locations. So, you're looking at this, you're like, great, there's a lot of pantries out there. We're doing great, which we are. But given all of these sites, we still have gaps, right? And so what we have done in order to kind of identify and dig deeper into those gaps and pull them out, and then also figure out what are some of those potential solutions, is to conduct surveys with both, as Jack said, with both providers as well as the consumers. And I'm going to bring Simran up to talk a little bit about the preliminary survey results. And we're saying preliminary because the survey just closed. We just finished the analysis, and we are still going to do a couple rounds of making sure we're doing the interpretations. Everything is 100% accurate. So which it should be, I should say, but just, still preliminary too.
Thank you, Limor. My name is Simran, and I'm a consultant with Charitable Ventures as well. And we'll share a bit of the highlights of what's come in through the surveys so far. And I will start with the provider survey. So in terms of results, as Jack mentioned, we had a great response. So thank you to everybody in the room who's a provider who was able to get information back to us. We were able to hear from 229 total responses, of which 189 were unique responses or from unique providers in the county. The provider survey was open for 1 month and was available in English, Spanish, and Vietnamese languages. This map shows where the providers said the populations that they serve come from. So as you'll see, it matches very closely to the map that Limor just showed you of where the needs are. So that's great that Central Orange County has the most coverage in terms of where the providers serve. We asked the providers, so what type of special populations do you serve, considering we do want to understand the equity perspective here in Orange County. And so about half the providers do serve older adults, 30% are equipped and do serve disabled residents. About 30% also serve college-age students, which was great to see because that tends to be a gap in food insecurity. Foster youth were served by about 23% of the pantries, and then LGBTQIA+ were also served by about 20% of the providers. So great to see some coverage for the most vulnerable in our communities. We talk a lot about, we do have great support in terms of food pantries in the county. And we just wanted to dig a bit deeper in terms of hours of operation. So yes, we do have pantries that have great coverage across the county, especially where the needs are. But let's also look at, what are those hours of operation that consumers, when they need them most, can get to them. So this shows that most of the pantries are open on the weekdays, and the most popular hours of operation that they're open to consumers is 10 a.m. to 2 p.m. Before 8 a.m., after 6 p.m., and on weekends, the coverage is, or hours of operation is fairly minimal. So it does give us a pause and something to work on. So we asked the providers, what do you see as the barriers to meet the needs of the food needs in the community for the people that you serve? And so the top 5 responses are lack of protein in their food supply, lack of transportation for their clients to get to them, difficulty storing food. So this is refrigerated trucks, etc., to get the food to their pantries, insufficient supply of food, so there's not always enough food to meet the needs of the consumers that they serve, lack of nutritious food options, kind of matching the lack of protein in the first response. And then closely followed by those top 5 responses was lack of consistent funding and lack of ethnically and culturally responsive food, which you also see a correlation in the consumer survey. So again, these are just the highlights. We asked a lot more questions of the providers that we will share in a report later on, but wanted to get these to you as our preliminary findings of the provider survey. And now moving on to the consumer survey. So again, this was open to the consumers of the pantries and other food sources across the county, as Jack mentioned, not just pantries, but churches, etc., of those places where consumers can get services at. And consumer, We had 811 respondents get back to us via online and paper versions of the survey, so we were thrilled with the response back. Gives us a good sense of what the consumers are feeling. The respondents reside in 43 cities across Orange County, and we had some from LA County, from the fringes, bleeding into Orange County, so Corona, Long Beach, etc. And the top 5 cities where the consumers reside is Santa Ana, Anaheim, Buena Park, Garden Grove, and Orange. So again, it's a lot of the consumers live in the central and north part of the county that do need the services. And these cities represent 70% of the respondents, so a good chunk. In terms of race and ethnicity of the consumers who got back to us in the survey, 60% are Hispanic Latino, about 20% are Asian American, and 16% identify as white Caucasian. We had other people identify as others as well, and those were mainly Black, MENA, and Native American and Hawaiian. In terms of where they go to get their resources, about 41% of the consumers said they get their food from the pantries. About a quarter receive their food from CalFresh. About 20%, their kids, I imagine, go to the school, and they use the school-provided lunches. A small portion, 12%, are on WIC, and then 6% are on the older adult food programs, such as food boxes, et cetera, that are delivered to them. Only about 1% said they go directly to the food banks, which is designed that way, so that makes sense. In terms of the utilization of CalFresh or SNAP, because they do have access to the food banks, and that's where a lot of them are getting their food. So there is an opportunity for some education and explanation of benefits here. We were happy to see on the second 2 bars about the question was, I am embarrassed to receive food assistance, and I'm afraid that I could be penalized for receiving food assistance. And over 60% did not have those concerns. So that is great to see that they're not embarrassed or not afraid for a majority of the respondents. The question was for the consumers, what would make it easier to get the needed food? And 21% responded with a pantry closer to home. Again, touching back on the transportation issues to get to the food pantries. 17% would like the food delivered to the home. 15% said they want to choose the foods that they wanted and different food options, touching on the cultural and ethnic foods that the providers responded with. And then about 9% that said that they want different operating hours, which was a bit of a relief after we saw the hours of operation chart that it's not a huge concern. So it seems like they're able to get there in a timely fashion and when the pantries are open. In addition to the consumer and the provider surveys, Charitable Ventures has also conducted 3 focus groups with diverse stakeholders on the provider side to understand issues around hunger in Orange County. And so the high-level findings from these focus groups pretty much align with what we're seeing in the surveys, which is transportation issues to food resources, enrollment in CalFresh or SNAP, fear of getting resources due to immigration status. Folks are looking for culturally familiar food, and so that is something that is important to them. Language barrier to get help, whether that's showing up at the pantry, knowing where to go, or signing up for benefits. So that kind of highlights our findings so far. Again, like I said, there are a lot of other questions that we asked them, but these are the ones that we wanted to highlight today to start the conversation with folks in the room and hopefully get to some solutions that are sustainable. With that, I wanted to open up to Q&A, and Limor and I are here to answer any questions related to the data that we have access to. Oh, did we skip it? Okay, thank you. This was related to providers. We asked them what are the potential solutions that are addressable. And so the top 5 responses are flexible funding to purchase food that meets needs of the community, resources related to food storage. So again, refrigerated trucks, etc. Transportation for the clients to get to the pantry. Again, similar to how the consumers responded. More outreach and education, and then transportation of food from the food sources to the provider locations, such as pantries.
We will, actually, just so you know, we are recording this, so keep it clean, everybody. We're recording the session, and just so you know, we'll stop recording during the table discussion portion, but we'll record it again. Back. So we're going to post that on the OCHA Hunger Alliance website, and we'll attach the deck there as well. So I know you guys are taking pictures and writing furiously. Don't need to. Okay, so Q&A, I'm going to run around with the mic just so we can get the sound good on the recording.
Hi, everyone. My name is Karen, and I'm with Farmers Merchants Bank Foundation. My question is regarding that slide that you showed about Midway being the most, the city receiving most SNAP programs or SNAP benefits. Do you have any research or any data to show why specifically Midway was the one that stood out? And is it because they have capacity right and enrollment? What is that factor?
The one thing I can think of without looking at the data, just knowing the cities, is this is from the census data. It's 2022 5-year census data. The one thing I'm thinking it could be is Midway City is a smaller, like it's a smaller population. So it could be that the data are just not as stable. But as far as like the reasons, okay. But as far as like other reasons, I'm really not sure, right? I mean, and just so Midway City is basically like Westminster adjacent, right? So it's that area. But the only thing I can think of without like digging too deep in the data, because it's not in front of me right now, is the sample size issue through the census.
Anecdotally, Midway City, I happen to know, has the lowest life expectancy rate of Orange County. Irvine has the highest. You will live 12 years less if you live in Midway City than if you live in Irvine.
Only problem is your hair falls off.
Thank you so much for the presentation of the data. My name is Liz Andrade, and I serve as the Executive Director for 211 Orange County. And I'm curious about whether there was an overlay on health insurance coverage or what sources of health insurance were accessible to those that were surveyed.
No, it was not.
Another question, since I have the mic. With that 15% in Stanton and proportionality to the residents of Stanton, was there also information collected or the data evaluated on those who qualified for CalFresh in that same region?
No, so it wasn't asked on the survey. And then as far as trying to get that data, I actually, what I tried to figure out is what, for something that's not included on these maps where we have otherwise, because again, this is just like a small smattering, is can we figure out what %, for instance, of those who are eligible are enrolled, given the social service agency data? The reason I'm kind of pushing not to use it is because it's not really necessarily accurate, because in some places you have areas that it has more than 100% of the people receiving SNAP, you know, because you're using 2 different data sources. And so it's kind of a little wonky is the only problem.
That makes sense. Yeah. Thank you.
I hope you're checking your steps, Jack.
Hello, my name is Eddie Burciaga. My question is, how many people are trained in the area of providing the services? Because one of the issues that I come across, you know, by training some of the staff that we work with, is that the frustration is sometimes they apply for the services, SNAP and all the other ones, and they get rejected. You know, the clients get rejected. And then so we're trying to go through all kinds of barriers. And so how much of the training is out there, trained service providers are out there helping and assisting these communities?
You want me to take that?
Sure, yes, please.
Well, in terms of the data part, we didn't necessarily look into that, but during the focus group, that comes up a lot in the conversations. But then you're running into barriers. So, for example, we had an example of an organization in Santana that are serving predominantly Hispanic historically, but after the pandemic, they saw a lot of Asians come through. And so now they don't have the competency to speak the language to actually help them sign up and all that, and just even to sit down and profile and understand what their needs are. So there's those little barriers that are popping up that we're starting to see.
And I think you touched on a really important point too, and like in looking in the data, it could be, we just don't know given this data, but something we want to explore further is it could be that some of these areas, it's the higher percentage of households receiving SNAP because there's also better education about eligibility and support and outreach and things like that. And so that's something we've been talking about, will somewhere be in the final report, so yeah.
Hi, I'm Beck. I'm the Systems Change Advocate for the Dale McIntosh Center. First of all, thank you for the wonderful presentation, and I am very much a data nerd, so I'm gonna ask a kind of question, which is my thoughts on looking at these maps is I would be interested in seeing additional overlays, for example, the percentage of people on Social Security, percentage of people on Medi-Cal, people living under the federal poverty level, and then the physical locations of places like social services for food pantries and stuff like that. And I was just wondering if you had an opportunity to look at those or not.
Yeah, so we've actually developed, or I've been making these maps because this is like, I was telling them earlier, like making maps is like my happy place, right? So what Social Security, I think, is harder data to get publicly. So if we can get it, we can map it. We did develop some maps on health insurance enrollment, and some of those other things as well. So yeah, but in poverty, of course, yeah, family poverty, household poverty, which is a little bit different. Yeah. And I love the idea of overlaying as well. The one thing though, and again, I won't get too techy, but I will because I can't help myself, is that, these are like static maps. So there's only so much you can show on one map. Like if you were gonna go online, then we could do like clicks on and off and stuff like that, but.
Train for the day.
And stable.
Hi, Dr. Patricia Reba, Serving Kids Hope. I have two questions. One, have you looked at the correlation between food insecurity and obesity in these? Because I feel like Stanton and Midway City are very high in obesity, at least for percentages, maybe not for the total number, just because their populations are so low. And the other is, I'm curious, the 811 people, those are people that actually accessed, right? So of course, those people, like that 9%, it's like, woohoo, the hours were fine for them. But is there any way to look at the ones that were actually referred that didn't go? Because I feel like those.
That's on Simran to answer the second. So the first question is, we don't have obesity data, right? It doesn't exist anymore as a public data set, right? We used to have until COVID, we could get some data from the school district. So from the California Department of Ed, we can get body composition for kids. They're no longer, I think they're collecting it, they're no longer reporting it, right? And so, and I think years ago, WIC used to be able to provide this data. Now it just doesn't exist. So I would love nothing more than to be able to include that information. And if anybody has like a magic wand, send it my way. You do? But is it at the, let's talk offline, because yeah.
Well, I'll just add, one of the reasons I mentioned earlier is we weren't just targeting.
I'd like to find out, sorry.
Thank you for asking that as well. And our next step that we're already organizing is some focus groups with part of the most vulnerable in our population. So we have focus groups with some of the disabled folks, seniors, college students, some of the ethnic minorities that were a very small part of our survey, to hear those voices as well, to understand folks who are not able to get here, what are they looking for?
I would like to point something out and then ask a question. First of all, early on we identified, and Second Harvest kind of led the way in going after data that went deeper. And this is a first shot at this. In other words, we need to go deeper and deeper with this data. But we also have large systems here like CalOptima, HCA, SSA. I'd like to find out from you guys, what do you think of this data? How does it mesh with what you see?
Maybe I go to the CalOptima. Sorry, I just saw you first, so.
So certainly we do have data on adults and children who have basically claims data is what we would be looking at. So we're happy to share the claims data at an aggregate level per census tracker zip code, however you prefer it, so that you can overlay the diagnosis of obesity within claims data. And we'd have to just go through what that means and how it's counted, because it's probably a lower rate than what actually exists. The other data source that would be interesting is the Conditions of Children report tracks, the 5th grade physical education. So again, scored differently, doesn't overlap exactly the numbers.
That's not provided anymore. That's the problem. They used to be able to get that information. Okay. It's no longer available. But the other stuff, I'm going to find you as soon as there's a break. So yeah.
I'll be right here.
Yeah.
Hey, we got time for one more question if you have.
My name is Reverend Thomas with Sunrise Community Christian Church in Brandon Park. And I was noticing that Saturdays and Sundays, not a lot of food is being given away. We used to run our pantry on Saturday also, but we was getting more people than we had food. So the problem is, if we get our food on a Friday, we don't have storage to keep it. So is there any way that
you're sitting at the right table, by the way.
The pantries it can be open on Saturday and Sunday so we can give food away, because as you said earlier, people eat every day.
And we have a recommendation for the report. Perfect. Thank you.
All right. Thank you. Thank you. Appreciate it. Okay. And one thing that I forgot where we're at. Okay. One thing I forgot to tell you is if coffee should be hitting right now. So if you need to run to the restroom, they're right there. You might have seen it already. You don't need to run downstairs. Okay, at this point, wanted to just kind of focus on the areas that has bubbled up in our research, and it's an issue of language barrier, immigration status. It has become a barrier for enrollment and benefits. Food distribution and logistics, right? How close people want to be to the food source, and the ability to get to it. Awareness of food insecurity and nutrition in the region, and then access to certain types of food. We heard that a lot about access to fresh fruits and vegetables and proteins. And then that kind of balance which Claudia alluded to, which is there's increasing demand that's happening right now, and but there's a decreasing access. Right? How do we address that right now while we're trying to build a system to address all the other issues at the same time? So at this point, you're going to figure all that out. So we'd like for you at your table, and do we put questions? Okay, so Mimi and Robin has a sheet with the questions on it. And we'd love for you to spend a little bit of time walking through these questions and share with each other at the table and have somebody record it on paper so that we can capture some of the thoughts. But also to have somebody just share back at the end of it. So we're going to spend about 30 minutes discussing this, if you don't mind, and then we'll share back. Okay? All right. Thank you. And if you had your discussion but haven't had a chance to write down on the forms that are at the table, please go ahead and take a moment just to take some notes down so that we have a few notes. And at this time, I'd like to see if we can get some people to share back and let's hear what you discussed, maybe some ideas, and we have an excited person in the back. Actually, just for the recording.
Hi, I'm Justine Makoff, and I'm here on behalf of Free Reign Foundation, and we're just so honored to be a part of this collaborative. I just wanted to say, to watch big organizations come together to address a common cause is sad that is not a common thing. And I think a lot of us are learning a lot from the power of having one voice for a message and a need. I'm more from the mental health part, but we also, mental health, we address a lot of individuals who are food insecure. So to bring in nonprofits doing work outside of addressing just the hunger, I think is such a smart way to address this. And so yes, it's an honor to be a part of this collaborative, and our table has some pretty fun, interesting things to discuss, and I can go through them really, really quick, as we didn't really do the last one, and the reason why we didn't do the last one is because we figured we still think we know what the need is, but until the data really shows us that we are on track and on target, we probably didn't want to start making recommendations based on what we had already learned. But the language barrier and the hours of operation were definitely in line with what everybody at our table had seen, and so definitely agree with the results in the data. That little cooktop stove that the turkey doesn't fit in was kind of one of the examples. Also that they thought maybe giving directions or instructions on how the food in the box could be used. There's a lot of barriers and complications that come with that, we understand. Also, there's a lot of food that's going to waste. So even though if the food bank can't use the food, lots of times it can't be deployed to another nonprofit, and that's quite disappointing and would like to address. And then of course, storage. I know a gentleman in the front there had mentioned storage being an issue. In terms of issues as a community that we could be addressing, we need more data. Right? Until we get the information, it's really hard to make decisions on what the need is. So more data on the things that we mentioned above. And then really, what can we continue to do? I mean, the fact that we're bringing philanthropy together and we're bringing funders together. Orange County Community Foundation was here. We have Samueli Foundation here. Like, you have to bring all the partners to the table. So we just said, keep partnering, keep talking, and keep getting data. We have the partners, everybody's dedicated, and everybody knows what they're doing in their space. So let's keep giving them the support that they need. And we also felt that the poverty threshold is too low. So really qualifying for food and other services, we felt that the poverty level is a little bit low. And we didn't, the last thing, I'm done, we didn't really understand in the slide, there was the poverty, and it was like 100% of poverty and 200% of poverty. So it was kind of collectively, we weren't quite clear on what that was. So if it's just our table, I apologize, but if we could get clarification on that, that'd be great. That's it. Thank you.
All right, thank you. Okay, Gary.
Poverty? Sorry, I was actually dealing with the work email, so I completely spaced things and listened. That's why, real quick, repeat the question. This is awesome. So, yeah. So basically, in 2022, it was in 2022 using 2022 census data. Was it? I think it was 15.9% of the population was living at or below 100% poverty. And just to give it a context, the poverty actual amount for a family of four is $31,200. So then the idea is, in Orange County, about 16% of the population are earning less, of families of four are earning less than $31,200. And then about 32, I think, if I remember right, are earning 200% or below poverty. And so it would be about $62,800 for a family of four. Ooh, I just remembered more than I thought I did. So there you go.
To summarize that up, there's a lot of people living, barely making it right now in Orange County.
Hi, I'm Barry Ross with the Sisters of St. Joseph Healthcare Foundation. Just a group from the data side. We thought there might be an opportunity to integrate school meal data, senior meal data, looking at sort of cross-sector. We also talked about the fact that most of the food pantries rely on volunteers, and they have a benevolent attitude to give out food. So how do they do other things, and how do you get volunteers on Sunday night? And, so we have to look at that system. But we had an idea around looking at the highest need cities in Orange County and trying to get the cities to say that they will declare themselves to be hunger-free cities. And within that, share the data with them and look at alternate sites where emergency food could be distributed. Fire departments, places that are open 20%. Also talked about with 211, they get many food, how to with their data.
Okay, all right. Thanks, Barry. Great idea. I think we have some city representatives, so if you want to be hunger-free cities, let us know. And I think United Way actually address homelessness in the same way, right? And so that worked really well too. Yeah.
I just want to add on the poverty level. Out of United Ways, out of California, every year they do a real cost measure. It takes in what really it costs to live in Orange County, for example. And so includes food and transportation and all of that. And for a family of four, it's close to $110,000 here. So it's a common set of data. It's all published if everybody want to use that, because it changes the dialogue, right, in terms of having that real cost.
That data. And then one thing I forgot to mention is this is census federal poverty level. This is not Orange County cost of living federal poverty level. So $60,000 in some places in this country it's low, but it's doable. In Orange County, it's a non-starter. So
10 years ago, I was working at Wells Fargo, and we were looking at affordable housing, right? And the 70% or 80% of AMI was at a certain level, and a lot of the housing organizations had to actually increase it to 120, 130% of AMI to get people to qualify, just because it's Orange County.
Hi, I'm Jordan Barrera from Higher Ground. Our group, we kind of went through all of these, and it was a really cool discussion to hear, because at our table we have people from different areas of the county. One of our people here are representing someone from South County, and she was actually saying that for the data, she'd be interested in going in deeper on some of the South County information, because she sees a high need, which wasn't reflected in the data. So she kind of want to look into that more and find out why. As far as operational hours of the pantries, that was another thing that came up. It would be interesting to find out maybe if we could survey directly from the schools to find out kind of interesting information on Saturday and Sunday pantries. I know that a gentleman up there mentioned that we need Saturday and Sunday pantries. And I know that there was not a huge percentage of people that said the hours didn't work. But we at this table all believe that that is in fact not true, because we have all identified families that we believe that that is going to be an issue for. The next thing that we talked about that was really interesting was talking about the difference, and this is more of a policy thing, in household versus family. Because of the cost of living, there are multiple families living in one household, but a lot of the food services that are out there, you can't necessarily apply with the same address. So if you have two families living in the same household, they were saying it can often cause an issue when applying for services, and they've run into issues, especially because we know in some of these homes, there's 2 or 3 families living in the same house. As far as one of the things that we talked about was with the schools, there used to be the free, there still is, right now it is free lunch, right? But we talked about school breaks, that being another big gap, right? So kids are getting school food, but what happens when they go on these breaks, and where are they consistently getting the food, and figuring out how we fill that gap. And then finally, another way that we thought that we could maybe work together is creating, number one, we know that in each of our areas there are food pantries, right? We just identified that there's food pantries, but if you asked me where several of the food pantries in our areas are and what their operation of hours are, how much of that's being duplicated in the same areas? And so we talked about, I think it is wonderful how the OCU Food Bank and Second Harvest have come together. In the same way, maybe there can be a way that the food banks in certain areas can have some sort of collaboration where they meet to make sure that they're covering the gaps in services of these hours, to make sure they're not overlapping, especially if they're really close to each other.
Thank you.
I'm the least important and knowledgeable person at my table, so I'm perfect to speak for them. We have OC grant makers, United Way, 211 OC. We've got South County Outreach. We've got New Song Church. And so what a great group to get together to talk about this. I think echoing what you had just talked about in the back, there's a lot of like a look for connectivity between service providers. So again, what you mentioned about the food banks partnering together to know what their hours and their service offerings are, what their food levels are. We talked about, which I think OC Hunger Alliance is going to be addressing, is some kind of like consolidated system where people know where the food is and who can share what food in real time as possible, to have less food waste and more food to address the need that's out there, the increasing need. We talked about connectivity as far as what OC Grant Makers does, as far as having the food security issue table and other issue tables where they're convening funders and nonprofits and others to talk about the issues. And I know the Hunger Alliance will have that function as well. But just so it's like connecting, it's the sharing of information, the better together, which I think the Hunger Alliance represents and is going to be fulfilling that promise. The role of philanthropy we talked about, working smarter, not harder. Again, knowing who your partners are in the local area so you can share food, you can consolidate your hours. We talked about staff and workforce development so that, a lot of times the clients coming into the food markets and the food pantries, it's the front line to talk about other issues and wraparound services. So the need for really good training among case managers and more case managers. I don't know if I missed anything I know Liz told me to talk about what resonated with me, which is the layperson. And they found the data not surprising. I think there's a question on, the chewing gum part, the walking and the chewing gum, is how the data will be used, and wanting to know more about that. Thank you.
Thank you. That was great for a layperson. All right, who else likes to share?
Hi, Janice Heckle with the Anaheim Community Foundation, and I have an amazing table here. Similar input on the data, although we would like to see some of the data on if there's something on college students, and we have some colleges here, and the challenge of homelessness, unhoused, and food insecurity amongst college students. So that was an area that we'd like to see some data on. Looking forward to the data on the people who are not accessing the food pantries to see if there's any barriers there and why. As far as the issues that haven't come up, we do like the 211 and using that and trying to get more groups enrolled in that so that we can close the loop on referrals and utilizing that service. Continue to utilize the COVID funding to be aware as it's depleted, that we need to have a plan to identify new funding and ways to replace that. Post-COVID economics, work on a plan to address the long-term system because there's an increase in everything. And then more pantry collaboration to coordinate days of operation to avoid duplication, especially with the faith-based community. Education on use by, best by dates to decrease food waste. And then exploring the needs of the unhoused and supplying them with food that they can utilize. It doesn't have to be cooked or stored and can be prepared and they can eat safely.
So I'm a note taker, so I was taking notes. So I apologize for taking a gap, but we had an interesting table. We had a gentleman from Disney Resort, so we got more of the funding side of ideas. And then we also, I'm Erin from CityNet. We also have CityNet here. We have the Latin Health Access, and we have the City of Stanton. So it was a mixed bag of ideas. The data presented question, we had a discussion on non-perishable food versus perishable, what is healthy, especially since that is a huge data point and question here. So is there a non-perishable healthy food that we could focus on? So sampling the data. So I felt like, oh, okay, we're on the same page. We also would like a deeper dive into city data. So that was a huge question. Are they, do they have more access, more education, more training, or is there just a greater need? So really diving into that area. For the second question, we agreed with the language barrier and transportation. Gabby was saying that at the Latin Health Access, they help mostly Hispanic people, but they did see post-COVID, during COVID, that a lot of Asian individuals were coming in, and so there was a huge language barrier. And Stanton was talking about food storage, so they aren't able, they serve 200 to 300 people once a month because they don't have a lot of storage and they don't have a lot of help. So one of the things they were talking about is they can't actually give out perishable items because they don't have refrigeration. So what does that look like, the funding on all of that? Finally, the last question, the gentleman from Disney said that now that the 5 focus areas have been identified, what is the actual plan forward? He wants to hear the foundational plan, how we're going to move forward with all the information that was presented today.
Great. Thank you. And that's actually a great segue as I wrap this up so that you guys can get to your next meeting on time. You know, and let me just go back since it was referenced. I think Larry from Disney was talking about this. So, you know, one thing I heard a lot, but the one thing that keeps popping in my head as each of you spoke is that there is this need for collaboration and working together, right? I think everybody recognizes that. Everybody recognizes the power that's in this room to do this together. And so that's what the Hunger Alliance is here to do. And this is really the beginning. And as you know, the next step is right now, the Hunger Alliance is actually working through what that structure looked like and how you can be involved. And so as we identify these, and again, this is based on preliminary data, and as we finalize this, some things may bubble up. And there could be ad hoc committees that could be working on specific pillars and specific strategy, right? But we need everybody's participation in addressing those, because then we can say, hey, this is what these are the goals that we want, and we can measure what kind of progress we're making. And so Hunger Alliance is this is sort of not the introduction, but really basically saying, hey, this is the beginning of our conversation. There's going to be many more to come and many ways to participate. And so as that structure solidifies, we'll come back to you, share that with you. And then we'll also have an opportunity to share the final report as well. So we'll have another conversation a little bit later. But in the meantime, think about how would you like to be involved? How can you participate in this? So I'll leave it at that question. I'll hand it over to Mike to wrap us up.
First of all, thank you again to everybody for being here. I want to point something out. Data, much like statistics or much like my environmental health inspection, is a snapshot in time. So what we're seeing here reflects who participated. It also it fuels the next step. In other words, this is not the be all end all. This is to help guide us, but it also should drive areas that we know we have to dig deeper. And I want to just go back because we were missing somebody earlier, and I want to point out now that this happened in large part because of the Samuele Foundation and OC grant makers. And Hugh is here now, so I want you to stand up because you were instrumental. We call this the county that identified how we can move forward and gave us the ability to do this, have this process. And then also, again, thank you to Ann and Charitable Ventures and to Sue at United Way. The funding was grant funding through United Way. And every step of the way, we've kept each other on track and we ebb and flow. But I just want to point out that currently, and again, Bear's mentioning we don't want to put our foot on the scale. We wanted to aggregate the data. We wanted to reach out before we move forward. But the current, or the next step that is currently in place now is an advisory committee has been formed to identify what is this structure of this Hunger Alliance. It moves beyond just 3 principles. It now moves into being all-inclusive. And what is that structure that provides access to every demographic and all these organizations, but also allows us to sing in unison and not have 400 different voices. So it's a challenge, and we will keep you updated. But I encourage you to just continue to stay involved with us. And again, thank you for being here and participating in this, because this is really, and I have to share, we work outside of Orange County, throughout California and beyond. People are talking about this. And we talk about we talk to other counties and they go, boy, if only there was some way we could get all of these stakeholders to participate together. No, it'll never happen. Well, it's happening here. And as Gregory Scott, the CEO of the Action Partnership mentioned, Orange County is big enough to matter, but small enough to get things done. And I'm just so confident that we're going to be able to get this done. So thank you all for being here.
Yes. And one final round of applause for the Dwelling Place team. And appreciate you guys hosting us. All right. Until next time.